But I've got an army of voices in my head. Voices in my head. How come my friends?
Hello, everyone. Welcome to another review for Chapter 2 of our EMT book, Wellness and Safety for the EMT. A lot of what this chapter covers is pertinent to a lot of our providers today as they're going through an increased amount of stress with the COVID-19 crisis. So these are lessons that we employ and learn and use throughout our careers. Just as a reminder, the 5 stages of grief we'll start with. So Elizabeth Kubler-Ross was a German physician who wrote a book, or several books, I guess, about grief. First one titled On Death and Dying. And she came up with the concept that there were 5 stages of grief that everyone went through. And they were denial, which then went into anger, which then leads you into bargaining, and then depression. And then eventually you come around to acceptance. Now, to define these a little bit closer, denial would mean that you are faced with perhaps your own impending death or the death of another, and you completely deny that it's happening. This is not happening to me. I don't want to hear about it. I don't want to talk about it. This cannot be happening. Anger is when you start then feeling, obviously, anger toward the situation and react sometimes in poor ways as a result of that. Bargaining is, what can I do? What can I do to make this not happen? I'll give you anything that you want. Often it happens with a higher deity, just willing to pledge anything to undo the course of events. Depression is where we start to isolate ourselves from people and we become sad. And then eventually this leads to acceptance, where they may not be happy about the death, but that they accept that it's happening. And what Elizabeth Kubler-Ross taught was that these happen in a linear motion. So you would go through steps 1 through 5, and eventually your goal would be acceptance. However, as grief studies have continued on, and the more that we've studied about grief, we now realize that it's not a line. We now recognize that this is something more like a circle. Oh, that's supposed to be a circle. So you might start in denial. You might go over to depression for a while. You might be in anger. Then maybe you're in bargaining, and you go to acceptance for a while, but then you scoot right back to denial again. So these, you can cycle through and through and through. Some people never actually get to the point of acceptance. They may just stay cycling in these 4, especially any grief that's initiated by sudden grief, so grief that's unexpected, like a car accident. It's very difficult to get to the acceptance phase, and some people just never do. So it's not as linearly compromised as what Elizabeth Kubler-Ross claimed it to be, but it is a series of stages that you may recognize even yourself going through in response to some of the calls that you go through on EMS. Now, when observing these stages of grief, a lot of times we see those up close and personal when we are in somebody's home who has died. A lot of times EMS doesn't participate in the news of, say, a cancer diagnosis where they are told they have so many months to live. We tend to be there at the very end where that death has happened, and then we have to express that to the family members and try to take care of them as best as we can while we are there. Some of the highlights of how we communicate with these people are things that we learned in the de-escalation class. So we don't take things personally. They're going to say things and do things that are not normal for them, and it's because they're in shock and their minds aren't working. You may even have some of the backlash of some of the anger, and they may say angry things to you, but just know that they're not angry at you. They're angry in response to the situation. So we're not there to take things personally. We're there to care for them as best as we can. And in doing that, we treat them with respect. Even if we disagree with their view on life, they deserve our respect while we are there. For communication, we want to enhance it as best as possible, including using the word dead. We don't use the word they have passed on or they're to a better place, because that can leave people in a space of not coming to acceptance. They may be stuck in a place of denial, especially children. So you need to use absolute words when communicating with them, including, "I'm sorry, but your mother has died." That's the most appropriate way to inform the loved ones of what had gone on. There may be requests to touch the body. Request to touch the body. That normally is okay, and what we try to do is treat the body with respect. We'll try to clean it up as best as we can, especially in the ER setting. You'll find us cleaning up vomit or maybe taking out tubes and the like, making them not appear as though we've been working on them for a while. This, of course, is done with permission from the medical examiner, so you have to rule out that there won't be an autopsy. You also have to rule out that it's not a crime scene before you can begin to clean up the corpse. If you remove any of the equipment that you attached on the patient, even though they're dead, it can interfere with the police officer's ability to investigate the scene or for the coroner to determine the cause of death. So if we put an airway in, if we put defibrillator paddles on, those stay on the body until we can determine that it's not a crime scene, the patient is not going to go for an autopsy, and then we can remove those things and make the setting a little more comfortable for the family. Additionally, we try to comfort them as best as possible. So sometimes that may be that you just give them a hug. We do a lot of close contact with patients' families, hugs, pats on the back, whatever you're comfortable with to express to them that you're there to support them. You definitely don't want to be laughing on the scene or telling jokes or acting inappropriately in that way, which I've unfortunately been witness to. You want to take your voice down a few notches and talk to them as though you're soothing a child. And it may seem weird saying that now, but when you're in the midst of that grief, you don't want a lot of excitement coming at you. You want a cool, calm voice to be discussing things with you. So just trying to keep everything as calm as possible and reassuring as possible is pretty paramount during that time. Now, even EMS providers themselves can become the patients, and we deal with a lot of stress just surrounding our jobs. And we'll talk a little bit about some of the forms of stress after I write out stress here. You can tell I'm using my hand mouse again. Oh yeah. This is home quarantine writing at its finest. Okay, so stress in the EMS world. Now, most people can qualify, what would some sources of stress be, right? It's the classic Grey's Anatomy episode I'm going to put there. And that's like your MCIs, deaths of children, maybe an abuse situation that you come into. If you treat a relative who is ill, that can also be pretty traumatic. Or any amputations or decapitations, any severe trauma to the body where we're not normally seeing the body that torn up. That can be a high stress situation. So those are ones that we expect at some point to come along in our career or line of work, but they happen more infrequently. The actual more common sources of stress would be long hours that we work and the extra shifts that we work. It's not a secret to know that EMTs and EMS personnel do not get paid what they're worth, and we are working on improving that. But that does lead to you working a lot of extra hours and not seeing your family as much, and just being tired. Also, the weight of life and death decisions weigh on you, and then making errors. You may blame yourself for errors that you made, and you may convince yourself that you are the cause of someone's death as a result of them, which can be a huge amount of stress on a person. So those are some of the sources. Obviously, that could be compounded by anything. Really, it may not just even be deaths of children. You may not have ever seen a dead person before, and seeing an elderly person who has died and respecting that death could be very difficult for you. So people react depending on their life experiences in different ways. They can be the source of stress. There are three sources, or not sources, but there are three main stress types that we look at. There's the acute stress reaction, which happens immediately. So you are on an MCI scene and you feel those feelings of stress, and they continue on throughout that call. So you may become emotional. After the call, you may be withdrawn for a while. Those are normal reactions. So immediately you're having those stress reactions in response to that situation. There's also a delayed stress reaction, which can take days, months, or even years to come back. And that may manifest itself in different ways, but including becoming socially withdrawn, very irritable, and you may not be able to quantify exactly what is causing you to be that way, and it is from a call that maybe happened last year with a child that had died, and you just had kind of buried that deep inside. And finally, you have the cumulative stress, which is typically called the burnout stress. So this is something that happens over time where stress just keeps building on itself, and finally you get to the point where you're exhibiting all these stress symptoms and you're not quite sure why, and it's just because of that continual building of all that stress that you've been exposed to. Some of the signs and symptoms of stress that we need to recognize are irritability, anxiety, difficulty concentrating. So you may try to read a book and you find that you're not able to focus on the literature at all. Indecisiveness, Oh, I feel like this is not indecisive. There we go. Maybe this is beyond not being able to choose where you want to eat for dinner, but it may be even things that are just major life decisions that you cannot just decide on at all. You may have feelings of guilt, you can't sleep, loss of appetite. So there's a lot of things that begin to manifest itself as a result of these stressors. And it's good to know what these signs and symptoms are so you can also educate your family. A big challenge of being an EMS worker is that our families aren't exposed to the same things that we are, and they truly cannot understand the things that we bear witness to and the things that we go through in life. So it can be very frustrating trying to express yourself to them when they just don't understand. And they'll want to love you and care for you and want you to be okay, but just educating them that they may see some of these signs and symptoms as you start to work and become more exposed to patients can be very important. So, you know about the stress, you know what can cause the stress, talking about how do you cope with it. And there's a lot of different ways that you can cope with it. A lot of these things kind of surround escaping the job. So when you first start, you will quickly become enamored with the profession and with helping people, and you will begin to pick up a lot of extra shifts as often as possible and want to be around it as often as possible. But that will quickly burn you out. So some of the things that you can do are arranging your schedule so that you still have family or friend time. Just because we don't have biological families doesn't mean we don't have families that we choose to spend time with as well. So prioritizing those people in your life and making sure that you have a very strong role in their lives with your schedule is also important. Doing things like meditation is something that's suggested, and it's not the classic Buddhist meditation where you sit cross-legged and do the ohms. Meditation can be anything from sitting in the sun and listening to the wind and just relaxing for a while, or listening to music, or doing yoga, or writing in a journal. So there's a lot of different ways that you can meditate. And it's important to sit with yourself sometimes and really just consider what you think about different situations and what you think about your life right now. Also, coworkers become a huge support system for you, and that's kind of why we begin to indoctrinate you into the EMS family, as we call it. They are the people that know what you're going through because they too have been through it, and so they become your best buddies. And it may only be at work that you're buddies with them, but you'll find relief in the stress by just laughing with them or talking with them about what you've gone through. Debriefs are huge for being able to cope with the high anxiety situations. So sitting around and saying, this is what I did good and bad, and making it a safe space to talk about that is important too. But you can go even further. So you have stuff plaguing you and you need help. Doing counseling is not a bad thing, even though our culture might say it is. That's something that we can easily seek out. And ultimately, if we're on a call that becomes very recognized of a high stress environment, the management may call what's called the CISD, which is the Critical Incident Scene Debriefing. And that is a specialized team from the state that comes and just helps you work through what you witnessed, but also to help you process the events and then to work through your feelings and emotions. Because ultimately, you're still the number one person that we worry about being healthy out of it. And a lot of that deals with emotional stress as well. So aside from stress, the rest of the chapter talks about things that we're intimately familiar with now, and that would be things related to the COVID crisis. So pathogens are that which will affect us and cause disease. And those include bacteria, which bacteria are living organisms such as, you may have heard of Escherichia coli. Those tend to infect the gastrointestinal tract and then cause profuse amounts of diarrhea. So E. coli is an example of a bacteria, and that can be killed with antibiotics. So we have treatment that can actually kill off bacteria and help the patient or you become better. Viruses, such as SARS-CoV-2, which we're familiar with, or HIV, can infect us. And we have no absolute treatments for these. These can be treated with antivirals, but that's not a cure. That just limits the amount of replication they can do in our system. So ultimately, right now we only have the bacterial sides that really, or antibiotics that will kill bacteria off. Fungi, such as mushrooms, disgustingly, can also infect our bodies. You will see a lot of fungi in the terms of like a yeast infection, and we do have antifungal agents that will kill that off, but you can also see fungal bacteria as a result of that, or not bacteria, sorry, fungal pneumonia, where a fungi has gotten into the lungs and caused a pneumonia from that. Protozoas can be derived from the dirt, and then they usually cause like massive amounts of diarrhea. You can also get them from water, especially when you're camping and stuff. That tends to be pretty high. And we do have treatments for those as well. And finally, you have the helminths, which after high school biology, I was never the same again after learning about these. These are the worms. So you can get tapeworms, you can get liver from improperly cooked ham, and they can get into your cardiovascular system or into your digestive tract and then begin to proliferate inside you. I pity you if I ever have to be your paramedic if you have one of those, because I will pass out and die if you tell me you have worms inside you. I would not handle it very well. So some of the ways that we protect ourselves from these, and we're becoming more and more familiar with this as we, work through the COVID crisis, so everyone should do excellent on this on any future exams. That would be PPE. So hand washing is still the number one way that we prevent the transmission of things such as viruses and bacteria from getting into our tract. It doesn't matter necessarily if you're around someone that has a virus. It matters if that virus can get into your body. So if you are around someone that sneezes on a counter and you touch that counter, that does not mean that you've gotten that virus into your system. If you take your hands that you've touched the counter with and then put something into your mouth, then that virus has been introduced into your system, which can make you ill. So it does have to have a route into your body, and some of that may be just breathing the droplets nearby. But hand washing is a good way to begin to minimize that risk of getting it into our bodies, as well as other good hygiene. For example, anytime that I have gone to the hospital recently, I've come home and taken a shower. So that's a good option to make sure that your body's clean and free of any of those viruses or bacteria that might be hanging out. This could include gowns, gloves, and typically you'll always wear gloves on calls at the minimum, and that's where BSI comes in, body substance isolation. At the minimum, you have gloves on. You might have eyewear of some sort of goggles or a face shield. You may wear a mask. And so these are the ways that we protect ourselves to try to prevent exposure from these pathogens that we talked about. Other ways that we can protect ourselves. So high-vis gear, especially when you're on the road during a car accident, is super important to wear. So it is by OSHA standards that the ambulances carry vests, and then we put those on when we're on the roadway. And if you need to know why, I would encourage you to look up videos of providers being hit with vehicles, especially in today's culture of texting and driving. That's becoming more commonplace. Just because you have lights on does not mean that people recognize or even see that there's an emergency scene and will slow down or get out of the way. So you always assume that someone is there to hit you, and that's why we wear this high-vis gear, but also we make sure somebody's watching our backs to make sure that we don't get hit. And finally, one of the things that they recommend doing, among other things, is sleep. So sleep can be really hard to chase after, especially right now. We're in a global crisis and you feel like you're called to work all the time. Maybe you get home and then you feel like you're called to take care of your family all the time. But you do need to prioritize sleeping and trying to get at least a minimum amount of sleep every time you do lay down. Because without this, you begin to lose cognitive ability and stressors become even more exacerbated. So it becomes part of your healing process, prioritizing that. They also recommend things that, everyone's heard before: eat well. And that's a number one thing that EMTs and paramedics complain about, is they don't have time to eat, so they begin to eat poorly. Just trying to make better choices with what you've been given. So even if you have to go to Arby's, maybe you get a grilled chicken sandwich and a salad. Trying to make decisions that will help feed your body with what it needs. Eating smaller meals throughout the day is also important. In addition, stress relievers that are involved with not drinking or utilizing drugs are important to seek out. So maybe you go to movies with friends, or you go to the gym, or you play sports. Those are ways that we can healthily begin to deal with our stress. Along with that is the exercise. They do recommend some form of exercise, especially in a profession where you will be required to be somewhat physically adept. So you're going to be required to lift heavy people. You're going to have to carry people or heavy objects for a period of time or a distance, and you need to be able to do that, because your inability not to do that can get somebody hurt. So even if you just have a walking regimen, you do some basic weight training, that is important to keep your body healthy, but also your partner's body healthy. So that's pretty much the review of the chapter. Obviously, during this time, again, it's pretty common for all of us to be feeling these symptoms, and it's right now the isolation techniques that we're utilizing to help try to save our country are very stressful. So I would encourage you to maybe reflect on that as you're going through the chapter, because if you put a personal attachment to the stuff that you're reading, you really are able to draw back on that knowledge a lot easier. So looking at this and saying, how do I fit into this? What are my current reactions to things? Or maybe reflecting on situations in the past where you've had these reactions and how you've dealt with them. That's going to help keep in your mind for when a test time comes and you have to regurgitate this information. All right, thanks for joining me. I hope you stay safe, and we'll see you soon.